Hello everyone, this is Dr.B.S.charishma from Department of Pediatric and Preventive Dentistry. This presentation is about silver diamine fluoride, a silver renaissance in pediatric dentistry. What is SDF? SDF is a colorless solution with alkaline pH, that is pH of around 8 to 10. It mainly consists of silver, fluoride and ammonia. Silver is an antimicrobial agent, ammonia stabilizes the solution, and fluoride it aids in remineralization. The most common concentration is 38%, which represents around 44,800 ppm of fluoride and 225,000 ppm of silver. Silver and fluoride at high concentrations, they have synergistic efforts with bacterial action on the karyogenic microorganisms. The commonly commercial available products are here therefore Clear, Caries Arrest, SDF, etc. So how does this act? The mechanism of action when the SDF is applied to the tooth structure, the following reaction occurs. The two main compounds which are formed are calcium fluoride and fluorohydroxyapatite. Calcium fluoride, this is loosely bound to the teeth structure and it can be considered as a reservoir of fluoride that that will be released if the pH drop occurs. Fluorohydroxyapatite, this is formed when fluoride is incorporated into the hydroxyapatite crystals, and this helps in the remineralization and makes the tooth more resistant to further demineralization. Also, high concentration of fluorides can inhibit the formation of biofilm since fluoride can influence carbohydrate metabolism and the sugar intake of the microorganisms. The silver ions, they exert a great antimicrobial effect, and there are different mechanisms involved in this effect. Silver ions can bind to the cell wall structure and inhibit the mobility of the bacteria or promote the rupture of the membranes. Silver ions do interact with the DNA of the microorganisms, resulting in the inactivation of bacterial DNA or mutation of the DNA, leading to the death of bacteria. So, where do you apply SDF? The main indications of SDF include early childhood caries, where the child is having multiple active carious lesions, children with behavioral problems as an alternative to sedation or GA treatment when the parents are not affordable, children with special needs like cognitive or physical disabilities who cannot cooperate for the long treatment procedures, also for the children with dental phobia or those who cannot tolerate the standard dental treatment for medical or psychological reasons, including precooperative children, multiple cavitated lesions or extensive lesions which need more intervention. Coming to the clinical procedure, how do you apply it? Firstly, explain the procedure and possible adverse events that can occur to the parents and should obtain an informed written consent. Then, oral prophylaxis has to be done to eliminate the plaque and debris from the cavitated lesions. A protective coating of petroleum jelly may be used to avoid the possible transitory henna appearing tattoo that can occur if STF comes in contact with the skin and the lips. The areas to be treated are isolated with cotton rolls or alternative methods. Then dispense the STF in dampened dish and bent microbrush can be kept ready for the application of STF. Not more than one drop of STF should be used. This one drop is effective to treat 5 to 6 teeth. And then soft caries can be excavated stepwise and dry the lesion gently with compressed air. Apply SGF only onto the affected surfaces and excess can be removed with gauze or cotton pellets. This is how it looks after the application of the STF. So there are some points which we have to remember during this. The first comes in application time. If possible, at least 1 minute should be the application time with gentle flow of compressed air till the STF is dry. 3 minutes of isolation of the treatment area is required. The next concern is application frequency. Biannual application is recommended for the better results. And the post-operative instructions commonly given are 30 minutes to 1 hour restriction on consumption of the food and drinks after SDF application, and follow-up is advised at 2 to 4 weeks after initial SDF treatment to check the arrest of the treated lesions. Reapplication or additional SDF application at recall appointments is needed according to the hardness and the color of the cavitated lesions or evidence of the lesion progression. The carious lesions can be restored after the SDF treatment with resin-modified glass ionomer cements or composites, and this is termed as SMART, that is, silver modified alternate atraumatic restorative treatment. So there are few concerns about SDF application. The primary concern is fluoride toxicity. One drop, which is adequate to treat around 5 to 6 teeth, it contains around 2.24 milligrams of fluoride. Many studies on SDF, they reported that there were no reported adverse systemic effects or deaths, though the long-term effects of repeated exposure to silver compounds is not known. However, a cumulative effect of silver uptake and risk of silver poisoning to occur, a total lifetime silver exposure of around 1 gram, which is corresponding to nearly 400 SDF applications, is needed as per the US Environmental Protection Agency. The another concern is black discoloration in the arrested lesions, which is disclosed after SDF application. This happens because the SDF applied areas, soft infected dentin turns harder and sclerotic black surface is developed on the tooth. The other side effects associated with any concentration of SDF application are the metallic taste, pulpal or soft tissue irritation, and development of small, white, irreversible lesions in oral mucosa and gingivitis. It should be remembered that SDF will not treat or eradicate dental caries, but it breaks or arrests the caries process of the surfaces that are treated. Coming to the conclusion, to conclude, SDF can be an effective, inexpensive, and a sustainable option for the high-risk children and adolescents across all age groups in arresting dental caries. It is a very potent and excellent antimicrobial agent in the prevention of biofilm formation and dental caries. It's a non-invasive, painless, and effective treatment. Thank you, one and all.